But first, your medical minute. Foot and ankle injuries can really slow you down, but Dr. Jonathon Wolf with Saltzer Health explains how we can both treat and prevent them. Dr. Wolf, what are some of the most common foot and ankle injuries this time of year?
In the springtime, we see a lot of overuse injuries. We see a lot of things like tendonitis, like Achilles tendonitis. We see things like plantar fasciitis, which is a form of thickening of the tissues on the bottom of the foot. And then we also see the typical ankle sprains that occur from doing the activities themselves.
What type of injuries require medical attention?
Emergency guidelines include the fact that if a patient injures themselves and can't walk, they should see a provider. Beyond that, any persistent symptoms that are concerning, like persistent pain, bruising, swelling, or something that just seems concerning is reason to reach out.
And what type of injuries would require something as drastic as possibly surgery?
Again, injuries that don't go away or injuries that have failed conservative therapy. If you've tried several weeks of physical therapy or a brief period of rest with immobilization, or you've been trying the over-the-counter remedies and things aren't getting better, well, sometimes surgery is required, and that might be the next step to get better.
Are surgeries safe right now during the pandemic?
Generally, yes, although the patient experience will be a little different right now. The hospitals in the Treasure Valley are going through different protocols to ensure patient safety and the safety of the staff. So your experience might include pre-operative testing to make sure you don't have COVID-19. It might include a small delay before your surgery to self-isolate. And then on the day of the surgery, your experience might include a different anesthesia regimen, where if you have to be intubated, they may actually have you in the room a little bit longer, both before and after the procedure, in order to protect the staff.
Good things to know and prepare for in the event that is required. Clearly, prevention is very important. So how do we prevent ankle and foot injuries?
The best prevention for ankle and foot injuries basically comes to making sure that you're ready to resume or start the activity that you've chosen.
Okay, so make sure we're easing back into that activity. Don't be too overzealous up front.
And listen to your body also.
Yeah. Good advice. And where can people go for more information?
Patients want more information, they can go to the web to saltzerhealth.com or contact their primary care provider.